Hi everyone. I just want to do an update on a few things actually. Um, First of all though, look what's behind me. Ooh, pretty Christmas tree. Just had like a psycho look on my face. I put up a Christmas tree. I know it's not even Thanksgiving, but like I'm super in the holiday spirit this year. So I already have like half of my shopping done. I'm so excited for Christmas. Um, and then on another side note, I got this pink wig like, I don't know, like 3 weeks ago now. And I absolutely love this wig. I went like crazy with the wigs. I have like, I don't know, like 25 now, but there's a few that I especially love, and this is one of them. It's super long. It's 55 centimeters, so it goes down to, oh gosh, down to basically down to where my pants start, and I absolutely love it. I feel like, I don't know, like a cartoon or anime character or something when I wear it, and it's just so much fun. I just get to play dress up every day. It's so much fun. Now to get into things. Third chemo. I went in this week Tuesday and Wednesday. Tuesday to get a full liter giant bag of liquid put in me as I was like severely dehydrated. And then some anti-nausea medication because I was still somehow nauseous. And Wednesday to get another full liter put in. The chemo dehydrates you. I slept all Friday, all Saturday, until Sunday. I had slept, for a couple days straight. And Sunday I was like, oh my gosh, I don't want to sleep all day again. So I was just like, I'll go about my routine. I went out to eat. I went to the store and went shopping. I actually had to sit down at the store because I felt like I was going to, pass out at any moment. Walking up a flight of stairs made me out of breath for 15 minutes. And it's still pretty bad. Even just how I'm talking now, I would be extremely out of breath. It's gotten a little better throughout the week, but basically for the first 5 days afterward, it was just so bad. Standing up felt like I was going to pass out. Walking more than a minute or two basically wasn't possible. I started to get dizzy. Had to stop all the time and, just take breaks. And for me being 21, it's like I should be able to walk up a flight of stairs without being out of breath for 15 minutes, even if I'm going through chemotherapy. That's not normal. Really rapid heart rate, especially standing up, moving around, talking, that kind of stuff. Really bad nausea and stomach pains. Absolutely no appetite, which those have been normal for me every single time I've had the really bad nausea with just no appetite. I usually don't have an appetite for about a week, and then my off week, because right now I'm doing chemo every other week because it's the high dose chemo. The off week is usually when I'll basically stuff my face with food all week to attempt to gain the weight back that I've lost, which has been more and more challenging through each chemo. I started my chemo weighing like 131 pounds, and now I weigh 120. I've had 3 chemos, and I'm having a total of 16. Hopefully the Taxol won't cause the nausea and appetite loss. The Taxol is actually supposed to be pretty easy as far as chemo goes, side effect wise. So I'm really, really excited to switch to the Taxol because this chemo has been hell. So once I switch to Taxol, hopefully I'll be able to gain some weight back. I am nervous after this 4th chemo because each chemo I've been losing about 6 pounds, and then I gain like 3 back basically. I just don't want to get down to like 115 or anything and have my bones sticking out while I'm standing and stuff. I don't want to look like sickly thin. So really excited to switch to the Taxol. numbness and tingling in my hands and also my kneecaps. For some reason, the tip of my tongue was numb this time too, which is weird. Minor mouth sores, which have occurred before. I also had headaches this time too. Anywho, just so ready to be done with this chemo. Just so ready to switch to the Taxol. I never thought I'd look forward to any sort of chemo, but I am so looking forward to the Taxol. So one more of the harsh chemo next week, and then I get to switch to the Taxol, which will be done every single week. So every Friday I will have chemo, but the reason they can do it every week is because it's not as harsh of a chemo and your body can handle it every single week. And so I'm thinking, you know, if they're going to be giving this to me every week, the side effects are just going to be so not as bad, which I'm so excited about, because then it's pretty much just uphill after this next chemo. I get to have easier chemos, and then I get to start reconstruction afterward, which I'm excited about. So, now I will talk about the Mayo Clinic. This is frustrating. When I went to the Mayo, my pathology, as I had said in one or two other previous videos, was out in Boston at Beth Israel, which is a hospital that is, you know, associated like through Harvard basically, and they were looking at my pathology because the kind of cancer, as I've said many times, is a very rare kind of cancer. So when I went to the Mayo, my lumpectomy, which was the actual, when they removed the actual tumor, was off in Boston. So the slides that were sent to the Mayo Clinic were my mastectomy slides. It was all of my breast tissue, which, you know, 99% of didn't contain cancer because they already had the tumor out. The only cancer that was left was basically the margins around the tumor that they had missed. The tumor was sent to the Mayo Clinic after it got back from Beth Israel in Boston. And when the Mayo Clinic looked at it, that pathology doesn't match the pathology from Sanford. The pathology from Sanford said that my tumor was 30% estrogen positive, progesterone negative, and HER2 negative. What that means, those are hormone receptors. What that means is 30% of my cancer cells responded to estrogen. Any cancer cells that respond to estrogen is basically a fuel for it. A fuel for it to be stimulated to grow and spread and just act quicker than it normally would. So if you eliminate the estrogen, you basically slow the tumor down. Now, the pathology I got back from the Mayo Clinic said that the first pathology that they looked at, that my cancer was 20 to 50% responding to estrogen, 1 to 10% progesterone, and HER2 negative. That would be basically the same, because 1 to 10% they consider. Did you see that? Did you see my cat just fly by? That was funny. 1 to 10% they consider to be negative. It's such a low amount that your tumor in general doesn't respond. So it's still considered basically progesterone and HER2 negative, responding to estrogen about the same percent as Sanford had said. However, they requested to do a second pathology on it for some reason. The second pathology showed that my tumor was only 1 to 10% estrogen positive, 1 to 10% progesterone, and HER2 negative, which in that case would make my cancer triple negative, which is extremely frustrating. Not only does it mean that the tamoxifen that I'm going to be taking for 5 years after my chemo may not do anything, because tamoxifen is for cancers that respond to hormones. that may do nothing, but also they treat triple negative cancer many times the same way they treat ovarian cancer, and they use completely different chemotherapy because the cancer is not a typical cancer. Triple negative is not typical, and they wouldn't be giving you the chemo that they're giving me now, because the chemo they're giving me now is for cancers that respond to hormones. To even consider that I'm not only taking a chemo that is scarring my heart and making it so I can never have chemo again in my life, but to think that I might be going through all this hell and have it be the wrong chemotherapy and have my cancer not respond to it, and then on top of that, what I was supposed to take afterwards, the tamoxifen, may not work. To even consider that is so unbelievably frustrating, because now I feel as if I'm taking the wrong medications possibly. And I asked at the Mayo Clinic for them to do testing on my tumor beforehand to see what chemotherapy would respond to my tumor. And I asked at Sanford, why are we not testing my tumor to see what chemotherapies respond? Normally, they only do that for triple negative because they're like, well, we need to find a chemotherapy that's going to work. Because they thought my tumor responded to estrogen more than it does, obviously, because they thought it was responding to estrogen, they were like, well, we can give you the typical breast cancer chemos because you have a hormone receptive cancer, so it should respond to this. Now thinking, okay, well, you're actually closer to being triple negative, not hormone receptive at all. I'm very frustrated because they should have done the testing like I had asked. And for them to brush it off and now get these mixed results is really frustrating. And on top of all of that, if I have a triple negative cancer, they're the hardest cancer to cure. It doesn't respond to anything. And so if it's triple negative, the survival rate drops significantly, as well as the reoccurrence within 5 to 10 years, basically the cancer coming back, increases a ton because it increases a ton because they didn't get rid of it in the first place because it doesn't respond to anything. However, it would make sense that I have a triple negative cancer because I have a secretory carcinoma, and a secretory carcinoma is almost always triple negative. The reason, the fact that mine responded to estrogen at all was weird. And so I'm not surprised that I'm getting pathology back now, a couple months later, saying, oh, whoopsie daisy, your cancer responds to nothing. I'm going to talk to my doctor about this, though, because it is beyond frustrating. I don't even want to talk about it anymore because I'm getting angry just thinking about it. Those are my updates. Yeah. Oh, I should have sat at this angle the whole time. You can see me so much better. I just wanted to have the pretty tree behind me because it's so pretty. I'm going to go. I'm going to eat now that I have my appetite back. So, I will talk to you all soon.